Hello, everyone. I'm your host, Dr. Vavlin. You're watching Open, the only live interactive program that brings the Bronx and New York City straight to your TV set. Stay connected to us through social media at BronxNet TV. Now, leading things off, May 6th through May 12th is International Nurses Week, a week dedicated to celebrating and recognizing the work that nurses put in, and they really go at it too. They take good care of a whole lot of people, including my mom. And joining us to share more, we have nurses Donna, Marku, and Fatima Sanchez, the Visiting Nurse Service of New York. Although it's there like that, I said it. Welcome. You guys are no strangers to the show, and we thank you, first of all, for all your service and all the great work that you're doing in our community, taking care of our, in most cases, elders. My mom is 88 years old. You guys have been taking care of her for a long, long time.
Wow.
And but this is what you do.
Yes.
It's National Nurses Week, but you said every day is Nurses Week.
Every day is Nurses Week, yes.
Yeah. Well, every day is Nurses Day.
Yes.
That's right.
You guys put in a lot of work, and we thank you for your service.
Thank you.
Okay.
So tell us about some of the things that you guys do and some of the services that you offer.
As an adult healthcare nurse with the Visiting Nurse Service of New York, I provide a myriad of different services. It can go from palliative care, it can, be touched on mother-baby. In the middle, it can be chronic or acute. We bring the caring home when no one else can.
Yeah.
So that's our goal, to give innovation to our patients at home so they can climb the ladder to be successful in, getting to their health goals. And that is the key role of the Visiting Nurse Service of New York.
Yeah. What do you want some of because a lot of caretakers involved in this.
Yes.
In my case, it's my sister taking care of my mom most of the time. I have to run from here to there to administer some medications.
Yes. Mm-hmm.
And you guys do a whole lot. Tell us about some of the other things that you guys do.
Well, we're actually a team of professionals. We range from rehab to home health aid, nursing, social work. So we all work as a team to provide the most highest quality of care to patients, and families are involved, and we do a lot of teaching and educating the family members on how to care for the
and you
patient.
reassure the family that
Yes.
everything is going to be taken care of. You guys have everything under one roof.
Mm-hmm.
Right. We try to stabilize that home to make them the best that they can, to be at home without rehospitalization. So
Bed
that's what we do.
sores. Bed sores. A lot of
Big
elderly
name,
people get
yeah.
Yes.
bed sores.
And that's where our wound ostomy clinicians come in to play as a team, like Donna said. We come together, look at those bed sores, and get the best treatment that we possibly can as a team. Not only does the nurses play a vital role, it's as well as the home health aide, if there's one in the home. Like you said, you run from place to place, but the implementation of a home health aide will, offset some of that time and pressure, so we don't get caregiver role burnout.
And preventative measures are very high priority when we start on day one, is preventing pressure ulcers. So it's a lot of teaching on how
That's
to...
a new name for it, pressure ulcers.
That's right.
Yeah.
There you go.
Pressure ulcers.
Yeah.
It's the nursing word.
You have to continue to turn that person, because if they lay in that
Yes,
one spot too long, the skin breaks down. And
that's
nutrition plays a
That's right.
very
Yes.
important
And the key element is your vitamin C, your protein, and those are things that family members don't know, and that's where we come in to teach.
Yeah.
Just a simple, cup of beans will help, help that bed sore, get back to its, normal state. So it's
here we are.
collaboration.
Yeah, you guys have been doing this for some time, right?
Yes. Mm-hmm.
Is there one thing that we should know in helping to take care of a person, being a caregiver? I know there's a lot of important things to know, but just give me one.
Patience.
Patience.
Yes.
Patience,
Patience.
yes. Mm-hmm.
Patience.
And
with-
willing to learn different things.
Yeah,
I
yeah.
think different ways of caring for family members, and being open to different instructions and
Yeah.
And
Because-
collaboration.
Yeah,
That's the
because that
best way.
person needs to feel comfortable too, that
That's right.
caregiver.
Absolutely.
That's right. And
That person
compassion.
can get sick too.
That's
Yep.
right. You need that compassion. Without that, your whole goal will fall apart if you don't have that compassion and peace.
Who calls upon you guys?
It can be direct from the patient to our intake line, or it can be referred from
Doctors,
doctors.
social workers, hospital facilities,
Hospitals.
nursing homes.
That's right.
And you guys have been in business for a very long time now.
125 years.
125
25
years. Give the Visiting Nurse Service of New York a big round of applause. Yes. And continue to do the great
Thank
work that you guys do.
Thank you.
That's right.
Yeah.
Thank you.
So, as home health care nurses in New York, what are some of the things that you do that the many people think of when they think about nursing? Tell them what you guys do. I mean, you think of the nurse in the hospital, but you guys make house calls.
Right. I think one thing I would like for the people to know that it's just not sick. We don't just take care of the sick. We take care of families that need the services for education purposes, or just to reiterate how to care for the patient at home. The innovation behind all of that is being up to date with the technology. So if we're not up to date with that technology, then things fall at the wayside. So technology and being able to collaborate that care is the most important.
Yeah. And you can elaborate if you want.
Could you tell me the question? She put it all out.
Well, the difference between somebody, we always see the nurse in the hospital, they
Yeah,
work the
home
hospital, but you
care
guys
nurses
make
is-
house calls.
Yeah, home care nurses are, I think, because we enter the home and you know a patient when you enter their home, and it's gathering everyone together to provide the most quality care for them. And
Quality
just-
care is important now,
yes, very
because
much
you
so.
have some organizations that come in, you throw it at you.
And
Yeah,
I
do
think
this,
you got to
and
look at
keep
the
it moving.
community too. It's like pharmacy. You have to know your local pharmacy. You got to also know your local senior centers. You got to know your local mom and pop stores and where to shop. So I think coming from the hospital, transitioning to home care is a little bit different if you don't know the community.
Yeah.
So it has to be a community effort.
Everybody
with-
plays a part.
That's right. Yeah,
Know where
to make
everything
as
is.
well.
Know what's
That's
in
it.
those scripts.
That's right.
All right, prescriptions.
That's right.
Yep.
It plays a part. And being in the Bronx, I think, is the highlight for me. I like the diversity in the culture, and that's what makes it home for me.
Yeah. Hey, this is the only mainland
That's
out of
right.
the 5
Yes,
boroughs.
That's right.
Absolutely.
This is
Yeah.
my
Yeah.
home.
Yeah. So there you go.
So-
Tell me one thing I don't know.
One thing you don't know.
Or that one thing we should know
One thing
about
you should
the Visiting
know.
Nurse Service of New York.
We provide an array of different services, like I said before, from the transgender population all the way down to being born. So that's one thing you probably didn't know.
Give them all a big round of applause, everybody. Where can we go for more information? The website or?
Yes, the Visiting Nurse Service of New York
Org.
.org. There we go.
Visiting Nurse Service of New York.org.
Yes.
I'm going to hold this up because VNSNY.org?
Yes.
VNS.
For short, VNSNY.org.
Yes.
That's beautiful.
Yes.
All right, for Team Sanchez, RN, VNSNY, and Donna Marku, RN, VNSNY. Thank you guys so much.
Thank you.
Look, I'm
Thank
still
you for
holding it
having
up.
us.
What does it say? What does it say?
Visiting Nurse Service of New York.
There you go. All right, we have to take a quick break right here, but coming up next, we'll sit down with a woman sharing tips on transforming your thinking. Uh-oh. We're going to slide you into another realm of thinking.